Nursing homes full. Hospitals have nowhere to send patients who are ready for rehab or long-term care. And while this won't solve the problem, sending in the Guard is a start. 13 WHAM's Tyler Brown spoke to a patient at Monroe Community Hospital tonight who says the overworked staff members there need the help. Tyler?
Doug, patients are sent to Monroe Community Hospital for rehab or long-term care. Flip Palizzi, who has lived there for 15 years, says reinforcement for the staff there will be welcome. Flip Palizzi has cerebral palsy. He's lived at Monroe Community Hospital since George W. Bush was president. Palizzi uses a computer to speak.
My name is Flip Palizzi.
He used it tonight to tell me about the staff shortage inside MCH.
We have 36 residents on my floor. During the day, we often have only 2 aides. That's not enough.
The county says nearly 189 beds are unoccupied due to the lack of staff, and lack of available beds at nursing homes means hospital beds are occupied by patients who should be moved to long-term care. Today, the Lieutenant Governor announced that National Guard members trained as EMTs will be deployed statewide to help ease the staffing crunch. Monroe County is getting more help than any other, 26 Guard members. Most of them will serve at Monroe Community Hospital.
They will be working with the community hospital in a way that makes sense. The county executive has said that they're going to start off with rehab beds. Those are the easiest situations to get involved in first, and there's a real need there. And then we'll see how the need is being met and then go from there.
This is clearly what's been identified as our hospitals is the number one thing we talk about every week. It's the nursing homes.
That's right.
That's really how we free up those acute care beds that people are much need here.
The elderly care nonprofit Lifespan says the move by the state will help, but it won't solve the long-term shortage of nursing home workers.
It is really a stopgap measure because we do have to address the adequacy of pay for nursing home staff in order to attract qualified staff to care for residents.
Residents like Flip Palizzi, who sees how the shortage of labor is impacting those who help care for him.
They burned out from working 12 hours or more.
The state is facing a severe shortage of people to staff group homes, and some of the people who live in those homes are paying the price. One mom from Dansville tells us her son's belongings were moved out of his home without proper notice on Thanksgiving Day. Tori Garrison is holding her own personal vigil outside the group home where her 21-year-old son Zachary has lived for 2.5 years. He says the home was closed on Thanksgiving Day and her son's belongings removed while he was visiting his father for the holiday.
I want them to bring his belongings back here. And I want them to do it the right way.
Garrison says she's not alone, that many other families are sharing the same pain.
Most of the people here don't have any family to speak for them. So they pick on the weakest people that have no voice.
The State Office for People with Developmental Disabilities says it and its provider agencies, as well as most human service organizations across the country, are facing a workforce shortage of crisis proportions. While it's working to confront that crisis, OPWDD says it's exploring options, including temporary consolidation of group homes to maintain quality care and workplace conditions. But Garrison says what the state is doing to her son is illegal, that he, like any renter, is entitled to notice of eviction.
And the individual has, at minimum, the same responsibilities and protections from eviction that tenants have.
Beyond the law, this mother of a young man with autism says the forced move is not healthy for her son.
He doesn't do very well. He doesn't handle change at all. He needs everything to be the same. He needs to know what's happening. He needs to know yesterday what's going to happen next week. This isn't going to be good for him.
Garrison says her son's belongings were moved into a facility in Dansville. She has not yet told him that news. Now, last week, the Hochul administration announced plans to spend $1.5 billion from the Federal American Rescue Plan to address the workforce shortage in group homes. So for now, the masking rules are up to individual businesses.
For stores and restaurants, this comes at one of the busiest, most important times of the year. As Tyler Brown found out tonight, some business owners are giving a mask requirement serious thought.
Yeah, Doug, Jenny, several local businesses plan to make decisions soon on when it will recommend masks for everyone, while others say they will only do it if the county requires it. Masking hasn't been required at gyms in Monroe County in nearly 6 months. Still, Austin Menengu says he wears one every workout.
My mom wants my whole family to still wear masks because she's still kind of wary about all of it, and it's nice for me to have the extra protection.
The county executive is hoping more businesses will implement masking mandates indoors to stop the spread of COVID-19 and lessen the burden on hospitals. Menengu's gym, Blink Fitness Center in Greece, says right now a mask mandate isn't being considered.
If there's any additional guidance that said that we had to do it, we're prepared to do it. But right now, I think we're just learning. We're paying attention to the situation as it progresses, as it unfolds, and using common sense and just, continuing to push the boundaries of how clean we can keep that gym.
Over at Dell's Market in Greece, the owner says the rapid rate of hospitalizations and COVID cases has him seriously considering whether or not to require masks for both staff and customers.
The state of emergency gave us a little kick in the butt and said we need to move a little faster with this. We've had a few regular customers here, unfortunately, that have passed away because of COVID. And unfortunately, none of those 3 were vaccinated. So again, you got to take this seriously, whether you believe it or not.
I also reached out to Wegmans and Tops grocery stores. Both are requiring masking right now for all employees, but will only recommend that unvaccinated guests wear masks in their stores.